This video explains the main steps to change the dressing of an indwelling pleural catheter, also known as a PleurX. The detailed protocol of the procedure is available on the MUHC intranet in the Policies and Procedures section. Search in the alphabetical section Drains. You will need a minor dressing tray, sterile normal saline solution to clean the insertion site, a pair of sterile gloves, 2 alcohol 70% and chlorhexidine 2% swabs, 2 alcohol 70% chlorhexidine 2% swab sticks, 2 to 4 sterile 4x4 compresses, 2 compresses for 4x4 drain, and a semi-permeable transparent dressing, large in size, 15 by 20 centimeters. Before doing the dressing, wear your PPE if the patient is on isolation. Perform the double identification of your patient. Explain the procedure to the patient. Ensure privacy. Close the door or pull back the curtain. Position the patient comfortably, and clean your work surfaces. Open sterile supplies on a sterile field. Put on non-sterile gloves. Partially open the alcohol 70% chlorhexidine 2% swabs and the swab sticks and place them on one side of the table. Remove the old dressing and examine the catheter, the insertion site, and the sutures if any are present. Sutures are usually removed after 2 weeks. The polyester cuff must not be visible on the surface of the skin. If the skin is visibly soiled, use normal saline and dressing tray supplies to clean the skin. Allow the normal saline to dry or pat dry with a sterile compress. Take an alcohol 70% chlorhexidine 2% swab in each hand and clean the catheter from the skin to the cap. Leave the cap in place. Touch the catheter only with the swabs and not with your gloves. Make sure that once you have cleaned the catheter, you do not touch it with your gloves. Continue to hold the catheter valve with an alcohol 70% chlorhexidine 2% swab using your non-dominant hand. Take an alcohol 70% and chlorhexidine 2% swab stick and clean the skin vigorously with friction for 15 seconds in one direction, flip the swab, and clean for 15 seconds in the other direction. Clean a surface of 10 centimeters by 10 centimeters with the first swab stick. Take the second swab stick to clean the rest of the surface. You need to clean an area larger than the size of the dressing. Be careful not to pull on the catheter. Do not remove any crusts or scabs. Gently bring the sterile field closer, holding the edges, and drop the catheter onto the sterile surface. Allow the disinfectant to completely dry. The solution takes at least 2 to 5 minutes to dry. Do not blow or wave your hand to speed up the drying process. Remove non-sterile gloves and perform hand hygiene. Put on sterile gloves. Place the drain compress around the catheter insertion site. Wrap the catheter and place it on the drain compress. Do not tie a knot or bend the catheter because it could damage the catheter. This will allow the catheter, including the valve, to be completely covered under the dressing. Cover the catheter with 2 sterile 4x4 compresses. The catheter should not be in direct contact with the clear film dressing to prevent accidental dislodging when removing the dressing. Apply a transparent film dressing. Discard equipment and clean the work area with disinfectant wipes and let dry. Remove gloves and perform hand hygiene. Document treatment tolerance or any side effects in progress notes using the DARP documentation method.